if there are questions. So I'm going to turn it over to Kanisha, and we're going to kind of dive back into the GSM, which we know you've been using, but to just kind of reorient ourselves to this set of tools that we hope have been useful for you all.
Excellent. Thank you, Erica. So like Erica said, some of the practices, some folks have really been using guided self-management. For people who are new to it, just for a review, what is the guided self-management approach? So, Erica gave you the quickest CBT overview there is, right? But we talk about the fact that, it could take years to learn all the different skills. There are so many workbooks. There are so many different ways to teach these skills. And we tried to distill it down into some of the most concrete evidence-based parts that give people opportunities to try different activities and worksheets and skills with patients and families. And so that's what the GSM approach is. So basically, it's a set of educational materials and worksheets that families can use on their own or with the support of you all to work on concrete CBT skills to feel and do better. We made a very big point of having there be a component that parents can learn and do alongside kids. And even for teenagers who want to be more independent and can do their own thing, we've got the guide set up just for them, but also their parents can follow along and know what they're learning as well. And it's just an easy way to offer these tools to families. We're all so busy. You also have so many patients. The pediatric practices are humongous, right? And it's hard to invent the wheel every time you've got someone in front of you. So having it all just accessible, easy, fun skills is just a quicker way to get this done. So who are the guides appropriate for? So the way we've put them together is that there's stuff in here that can work for just about anyone. So for folks with subclinical or mild presentations of the most common disorders, our ADHD, anxiety, disruptive behavior things, depression, these can be used as sort of a preventative strategy or a first step while awaiting treatment. So to give it to people to work on at home. For patients with more moderate presentations, they can use them together with you and part of a one-time session or brief treatment to work through this as an ongoing treatment approach. Other things to think about when you're thinking about how people will use this is, obviously the severity of their symptoms, but also the family's culture, their organization, and motivation. And when we say family culture, we mean, is this a family that's going to be able to take home this packet and knock this out, or are they going to need some more support? Will you give this to someone and they will lose it in their email and never think about it again? Or will they be able to put it in their calendar and work on it, with their child once a week? So kind of thinking about how people are feeling. And then motivation. Are we saying this is a problem, or is the family saying this is a problem? Does the child notice that this is a problem? Motivation is such a key factor with any sort of self-help approach, right? So just thinking about all those things while also holding the symptom severity in mind is super important. Like I said, 4 target problems. There's a guide for anxiety, a guide for depression, a guide for ADHD, and a guide for disruptive behavior. And there are 3 types of guides. There's a guide that is meant to be done for children and parents together. It's for the ages about 6 to 12 for the anxiety, depression, and ADHD sections, and for about 3 to 12 for the disruptive behavior section. There are guides for teens, so 13 and up, for anxiety, depression, and ADHD. And there's a guide for parents of teens for anxiety, depression, and ADHD. And it's typically easiest for families to work on one problem at a time. A lot of people have comorbidities. We often don't see a clean version of anything in the regular world, right? But if a child is dealing with ADHD and depression, we kind of think about what's the piece that's going to give us the most bang for our buck? What's the thing that's causing this family the most difficulty? Let's start there. And this is how they look. They're all structured in a similar way. It lets you know what the problem area is, what the intended audience is, and the appropriate age range. And then they all have this format with the table of contents in the beginning. So basically, there's an introduction that could either be read by you, by the parent, by the child, depending on their age, and just kind of explains kind of what this is all about, right? Kind of normalizes and explains kind of what CBT is, normalizes that lots of people deal with whatever the symptom we're talking about is, and then talks about what we're going to be doing in the guide, right? Here are the skills, here are the exercises, this is what they look like. It just really tries to set the tone for this is going to be an affirming, positive way to learn some good skills. And so each handout has a similar structure, though there's a little bit of differences based off of like what kind of skill we're trying to teach. But it starts off with a description of the skill and how it can help. And then there are instructions on how to use it. And these instructions usually include scripts that can be read like literally word for word by a clinician or a parent to help introduce these things. So like this has like, there's 3 things you're supposed to be doing, right? And you can read those scripts directly. Well, we'll dive into this more. This is just to try to show you what it looks like, so you don't have to feel like you have to read this tiny print. And then there are the worksheets to guide home practice or your homework, making it just really straightforward. You don't have to make anything. You don't have to, scour the internet for random mood trackers, for example. Here's one right here ready for the child to work on. And then at the end of each skill has something called the rationale and the common parent or common team concerns. Basically, how is this supposed to help us? Why will this help my family? And then common concerns that Erica and I have heard families have when they're learning these different skills, and an answer to that, so that you feel empowered to give folks some good answers to how these things work and why they'll be helpful or what to do if any problems come up. And like we said, the teen and parent guides are separate. Really depends on age, relationship with family. People like to sometimes often be kind of independent with their work. So like teens have a guide that they can just do on their own. Things are kind of put in a more sleeker layout with still some of the fun cartoons, but a little bit less. And some of the content in terms of like kind of the subject matter or the sorts of examples are a little bit more targeted to teens. And then the parent guide kind of helps say, this is what we're learning. This is what your kid is doing in the guide. All right, so like I said, super quick, if you want to look at any of this more in depth, you have access to these guides, so you can really dig into them, and you'll need them when we go into the breakout rooms. But any questions just on kind of like the way we've put together this approach? Okay.